My name is Dr. Hamisi Kotayali. I'm the CEO and founder of Premier Rehab and Wellness Centers. Premier Rehab and Wellness Center is a natural healing center that specializes in treatment of musculoskeletal conditions and internal dysfunction without the use of drugs or surgery. I specialize in dry needling or acupuncture, if you want to call it that way, functional movement screens, and recently got certified as the first African fascia manipulation therapist by STECO. I'm also a trained chiropractor, and my background before was in physiotherapy. I also practice another technique for fascia that we call fascia distortion model. Today we're going to be treating a patient who has what most people call sciatica, or rather pain from the back that runs down your leg, with also a backache. And we're going to use dry needles or the acupuncture needles. We're going to use some cups. We're going to do some decompression so that we can relieve the pressure from the nerve. And we're also going to be able to do some Shiatsu, or some muscle massage using a Japanese method called Shiatsu, so that we are able to loosen the muscles that we have worked on. After that, we're going to go to the gym. And in the gym, we're going to be able to show patients corrective functional exercises that will help the patient strengthen, first of all, stretch out the muscles, strengthen their back so that they don't get this recurring. Okay, and then after that, we will be able to provide the patient with a home program. And the home program is just the exercises that we'll be able to do, and using a foam that will roll on to be able to loosen the muscles at home, so that the patient can be able to continue doing some massage kind of a thing on their muscles when they go home. So the first thing that we're gonna do is assess the patient. So we have the patient on the side of the bed, and we ask the patient, first of all, take a history. What happened? How long have they had this problem? Have they ever had this problem before? Do they have any other pain or ailment that they are having right now? Or do they have another problem they suffered before this incident? And have they had any doctors who have seen them before? Have they had any x-rays or imaging that have been taken, be it MRI, be it CT scan, be it x-ray, whatever they have, we end up having a look at that. And then now we carry out a detailed orthopedic testing and functional testing. This is to be able to be specific at exactly where in the back this pain is coming from and what exactly is causing it. So as we start on the examination, we check for the leg length. We want to see if there's any deficiency in terms of the leg length. We also want to see if there are any restrictions within the spine. And then after that, we check the front. Most people, when you go to have treatment for the back, they don't look at the stomach. We look at the stomach because the stomach and the back work as a canister or a container that supports the trunk as a whole. So we have to balance muscles in the front, and we have to balance muscles in the back. And we go to the legs because most of the muscles that contribute to the pain in the back are spread out on the legs. Okay. Now, then we have these specific spots. Once we have identified where the pain is, we have specific spots that we feel with our hands, and this patient, they always feel like a knot, like they have a knot inside. And it's in these spaces that we are putting the needles. So we find the spots in the different places according to our finding from the physical exam. So we're gonna do here, we're gonna do here, then we're gonna do forward here. the needles on these spots, and once you have put the needles on the spots, then we end up putting on capping, or rather fire. We cap with the fire. The whole idea here is to be able to have a bigger area. You know, a needle is very thin and you have a knot. So if you want to diffuse that knot bigger, then you put the needle and then you put a cap so that you're able to suction the tissue, you're able to lift the tissue, to stretch out and relieve the pressure deep in the muscles and on the nerves. So we do that, and we keep the needles for about 15 minutes, so that the needles can soar, or rather they can loosen up, the muscles can relax. And once we have done that and the muscles have now relaxed, the next thing we do is we use a special bed that we call the Cox table. The Cox table is one of the specialized beds used to treat nerve impingement, or nerve when somebody has a nerve trap or pain that it's radiating either in the hand or on the leg. So this bed is specifically designed to be able to move in 3 different directions, and depending on how the patient has presented, you want to decompress. You have loosened the muscle, so you want to now start stretching those muscles, stretching those ligaments, so that you can decompress the pressure from the nerve. Okay, you move the bones apart, and the nerve gets free, so that you are able to relieve the pain. After doing the decompression, then we do what we call spinal manipulation. So spinal manipulation, in the first stages, we use the same table. So the table has a mechanism that you use to be able to do some drops. And as you drop the table, what you're doing is you're creating movement within those joints. Because when you're in pain and the back has gone into spasm, what happens is that the joint locks, and that's why people have a lot of pain. So once you have loosened the muscles, the next thing you want to do is be able to make the joints freer, so that it's easy then when you start doing exercise for the patient, you don't cause the patient the same pain that they had. And after we have done the decompression, the next thing we do now, we do Shiatsu. Shiatsu is a Japanese massage that it primarily follows meridian, body meridians, to be able to follow the line of the muscles that were spasming in the back. So the therapist, who most of them, like the one we have in our case, she's blind, and she has trained at Machakos School for the Blind. That's where they have learned this, and this has been taught by some Japanese JICA who come to do the training. Now they work on those muscles, they loosen the muscles, the patient now becomes more pain-free. once the patient has become more pain-free, then we move now to the next stage, which is now the recovery stage. And in the recovery stage, we do the stretching, and then we do what we call corrective functional movement exercises. We start with a very basic, like a child. We start with developmental exercises, or rather developmental pattern, which is rolling. The first thing we want to be able to have the patient roll. But because the patient is in pain, you just don't tell them to roll without support. So you give them a band to give them assistance so that they don't feel their pain. Otherwise, if you do the rolling without the band, then the patient will feel the discomfort in the back, and you may elicit a spasm. So you give them a band so that you can connect the hand and the body becomes like firm, and then they are able to do the exercises pain-free. So they'll do both in the front and in the back, and once they are done that, the next thing that you do with them is you advance the exercise a little bit. We go to what we call camel back. You're moving your back down and up so that now you can start initiating that shock absorber capability of the back. Then, after that, we do some foam rolling, because the patient needs to have something they'll do at home. Okay, so we have this foam that the patient sits on and rolls the muscles of the butt, the muscles of the legs in the front, and the muscles of the back of the back and on the sides. When you roll these muscles, the whole idea is for the patient to be able to have a home program or an activity they can do before they come to see me again, so that their muscles don't spasm again. When we finish with that, we make a printout of the exercises to the patient, so that the patient can now have a home program to use at home. We treat the patient once a week for 6 visits. Most of the time, most of the patients in 6 visits are already done with their pain. They're fine, they're feeling good. So after they have felt that, then we move their exercises to the different level. You make the exercises harder as the patient improves, so that then the patient back gets stronger and they're able to go back to doing the activities that they're not able to do. When the needles that we use vary in sizes. You have small needles and you have long needles. All this depends on where on the body you want to put them. So if you're needling somebody on the chest, you have to use smaller needles because you don't want to go into the lungs. If you are needling somebody on the bum, you can use a longer needle because the muscles are bigger. The fire. We use fire to be able to create a vacuum in the glass. When you create a vacuum in the glass, then you trap air. You clear air so that the glass can then be able to suck, to suction the tissue where the needle is. The next thing that happens is that now when you leave it for some time, the tissues get pulled. It's like the tissues trying to being pulled together, and that is what helps the muscles to relax. You can use this treatment for sports injuries. You can use this treatment for migraines. You can use this treatment for headaches, shoulder, knee, heel pain. Any pain within the musculoskeletal system or within the body, you can use it. You can use it for painful periods. Even for people with endometriosis, you can use that to be able to relieve them pain and have them function better. So, and you can also use it for patients who have internal problems, for example, constipation, for example, acidity. All these problems, there are ways you can put the needles in specific places and be able to help patients recover from those conditions. I'll put a disclaimer though, that this is not something that you go and do on your own. You just don't go and do it at home. Don't just go putting needles on your body, because you have to be trained. You have to understand the proper anatomy. You have to understand the proper where the veins, where the nerves and other blood vessels are located and important organs, so that you don't put needles and cause damage to them. So I would put a caveat: if you have not been trained, kindly don't do it. The different sizes of the needles of the glasses we use is all based on the area again. So if you're putting on the back, the muscles of the back are bigger and stronger. So you need to put a bigger glass that will cause enough pull. Okay? If you're putting it on a smaller area, then the diameter of the glass needs to be smaller, because you need to be able to pull the muscles that are smaller. The number of needles to be used in the treatment all depends on the presenting condition, what the patient has at the time of consultation. So it can range. If you're once you have gotten enough experience in using needles, you can use a maximum of 18. You can use a minimum of 6. So it all depends on how well you're trained and how well you know to use to use the needles, and how well you're able to correlate the problem of the patient and what you want to do and what you want to achieve. So everything depends on the chronicity of the problem, complexity, and the experience and the knowledge of the provider. If you're going to do it on a pregnant lady, you have to be very good, or you have to have, actually it's not recommended within the first 3 months, because it's easy for you to cause a miscarriage. And also you can still do it, but there are parts of the body that you cannot put needles when somebody is within the first 3 months of pregnancy. Acupuncture has been there for many years, but over the last maybe 20 years, you'll find that in the Western world, in America, in Europe, in Australia, in China, even in South Africa, it's become very, very popular because of its efficiency and how quick it is to relieve pain. I am the first person to start doing dry needling in this country. We have also been able to help to train a few physiotherapists in this country to be able to do the same. You can also do it to children, but with a consent from the parents, and you cannot do it to very young children, because they keep on fidgeting. So when the kid keep on fidgeting, then it's not safe to have the needle. However, when the kids they can follow instructions and they are able to be calm, and you have their parents to help you with them, because the needles are not painful, then you can be able to do it. Maybe from the age of 6 and up, or maybe 10 and up. The first thing we do is a consultation. So the session of needling is about 5,000. So that gives all what we have done will cost you between 5 and 8,000. Depending on your chronicity of the problem. So it's a variety of the 5 processes that we take the patient through, and that's how we are able to charge per visit. If you have back pain today and you're going through therapy, it will take you maybe about 10 to 20 sessions to be able to clear this problem. We are able to fix the same problem within 6 visits. So it's actually cheaper if you look at the overall cost in terms of results and expense. When you look at our statistics in the office, our ladies always ladies don't like feeling pain, and they always take care of themselves. So whenever the ladies are in pain, they will seek treatment faster. So men come, but most of the time men come when they're in a lot of pain. Ladies who come actually earlier, and sometimes it's very easy to fix ladies than to fix men, because men who come when they're in a severe pain, their condition is very advanced, and it may take longer to fix them.